The respiratory system is the way in which we get the gas nutrients that we need into the body and the metabolic wastes that we need from the body. Respiration starts in our nose, in our nasal cavity, and it's actually very important to start respiration in our nose rather than breathing through the mouth because the nose has some very important functions. The nose is lined with little bits of hairs and little fingers of tissue called cilia that are aligned with a layer of mucus. This layer of mucus will warm and moisten the inhaled air coming in through your nose. If you've ever been outside on a really bitter cold winter day and you take a breath in, it can actually hurt pretty badly. In order to protect our delicate lung tissue from that cold air, the nose is there to warm that air and to fill it with moisture. Also, those little layers of mucus help to trap dirt and dust and particles from getting down into your low respiratory passages. And we have a passage that's in the back of the nose and back of the throat called the pharynx. The pharynx has three sections to it. It has the nasopharynx, the oropharynx at the back of the mouth, and the laryngopharynx, which is at the really base of the tongue, tippy top of the throat. The nasopharynx is only at the back of the nose, but the oro and the laryngopharynx are also passages that are shared by your digestive system. Your food has to go through there in order for it to get to the esophagus. At the junction of our esophagus and our windpipe, which is called the trachea, we have a little flap of cartilage called the epiglottis. The epiglottis is there to protect our trachea, our windpipe, from getting bits of food in it, basically. What the epiglottis does is this flap of tissue is pointed backwards. So when you swallow, the muscles of the tongue push this flap of tissue to close over your windpipe so the food can go right past it down into your esophagus. When you're breathing, however, this epiglottis is wide open to allow passage of the air. So our air is going to come from the nose again, down the back of the throat and the pharynx. Then it should go into the top of the windpipe called the larynx. The larynx is what we traditionally know as our voice box. Our air is going to pass into the top of our windpipe called the larynx, past the vocal cords, down into a cartilage-lined tube called the trachea. And it's lined with C-shaped rings of cartilage that will hold your trachea open all the time, so that way we're never worried about suffocating because the passage isn't open. The trachea then splits into two branches, one to go to each lung, called primary bronchi. The bronchi then split into three branches called secondary bronchi, and then the secondary bronchi split into even more branches called tertiary bronchi. It's just as if you were picturing a tree coming up from the trunk, and as you're going up the limbs. It will start off as the big trunk, and then you have two big limbs branching off, and then more and more and more until you fill up the lungs with these branches. The tippies, tops of these branches, you're going to have little twigs. And the little twigs in our lungs are called bronchioles. At the ends of these bronchioles are little buds. They look like little bunches of grapes, actually, at the end of these bronchioles, just like if you see a tree in the spring, it has little buds on the end of the limbs. These bunches of grapes are called alveoli. And these little bunches of grapes are where the actual oxygen exchange happens in our lungs. Makes them incredibly important. And really, of all the structures in the lungs, those are the only places where we actually do exchange oxygen. This is the functional part of your lung. Each of these bunch of grapes are surrounded by little veins and arteries called capillaries, like hands surrounding those bunches of grapes. The oxygen will move from the inside of the bunch of that grapes into the bloodstream through a process called diffusion. And the waste products, the carbon dioxide and other gases, will move into the alveoli so you can exhale it out. You have over 3 million alveoli between your two lungs. 3 million little microscopic grapes where the oxygen exchange is happening. The lungs themselves have different parts to them as well. The lungs have something that we call lobes. You know, in the heart we call them chambers, but in the lungs we call them lobes. We have two lungs, obviously. We have the right lung and we have the left lung. The right lung is actually a little bit larger than the left lung and divided into 3 lobes, where the left lung is just a teensy bit smaller and it's divided into 2 lobes. The left lung is a little bit smaller because we have to have space for the bulk of the heart, which sits slightly off to the left in the middle of your thoracic cavity. So we have a little depression in that left lung called the cardiac depression to make room for the heart. Respiratory system is obviously vital to the functioning of your body. In order to do anything, we need oxygen. In order for the brain to function, we need oxygen. In order for any muscle of any other system or any other organ to function, we need oxygen. And our way to get oxygen in is through the lungs and our respiratory system.